You know,
They don't want to. They don't want it out.
How did that happen? Yeah,
You know, Harvard's full of secrets. So
okay, thank you. And maybe this doesn't answer your question, but when you say quantify, you mean, what do you mean? Do you mean how to prove it?
You had to
Yeah.
prove it.
Okay, all right, that's all right. So the question is, there are many examples, but here's one that's off the top of my head. If you are a Latino male, age 21 to say 35, and you're in Southern California, and you break your leg, and you go to the emergency room with a broken leg, you have 50% less chance of getting narcotic medication for your fresh broken leg if you're Latino than if you're Caucasian. Okay? Now, a broken leg is pretty easy to diagnose, and you take an x-ray and you see it's broken. And it hurts like the dickens. You know, it really hurts very bad. So why is that? You know, who decided that? Well, there's no policy, but if you look at what happened one by one with all these patients coming in, the Latino patients have 50% less chance of getting morphine or appropriate analgesic medication than otherwise. Okay, and people were sort of
sorry, I'll just.
yeah. Yeah. Oh, okay. Yeah, just moving as I talk.
No, no, you can move. I want you to be relaxed.
Oh, okay.
But I just leave the mic up so it doesn't scruff up.
Yeah, okay, all right. So people were kind of shocked by this. They said, okay, well, let's do the study again. So this time they did it in Atlanta, only they looked at black males compared to white males. And the outcomes were essentially the same. The black males had 50% less chance of getting narcotic treatment of their fresh broken fracture. And we know it hurts like the dickens. A fresh fracture hurts like hell, you know. And so that's just that's a prototypical example. But you can run that with women who go to the doctor with joint pain, who ought to have a total knee joint, artificial knee joint, and maybe half of them won't have it recommended, the other half will, and the Caucasian women will have it recommended at a much higher, I'm sorry, males will have it recommended at a much higher rate than the females who are going in with similar problems. So, but now, so that's part of it. There is a test which at some level can show bias. It's called the Implicit Association Test, IAT test. And Yolanda can give you the URL if you'd like to. You can take it yourself.
Okay.
You may be surprised at biases you have you don't realize you have. Now, but it's a test you can take on the computer, and you're asked to give responses to certain things. And if you're biased toward, you can take whichever test you like to take. You know, you're biased toward African Americans or toward Asians or toward gay people, you can take it to see what it shows, if it shows you positive. Now, having said all that, it's very, very popular. People have a lot of faith in it. However, it isn't really proven that if you flunk this test and you show bias toward African Americans, it isn't necessarily the case that as a doctor, when you see an African American patient, you're going to treat them with bias. That hasn't been proven, but there's good reason to worry that you might. I mean, it's not fair to determine that from the test, but it does give you a real sense of what's going on, and it does attempt to reach out to the subconscious, because they ask you to answer questions real fast, and as you do that, your biases will tend to come out and show on that test. So you can ask Yolanda to give you I should know what it is, but as Professor Banaji, who's a professor here at Harvard University, who developed this test. Yeah.
All right, so you had given, you gave a couple of examples, a checklist for patients and caregivers.
Mm-hmm.
what are the four for patients?
Mhm.
Corporate and respond to demographic questionnaires. This is for patients.
Mhm.
So how would they go about that?
Yeah.
Corporate and respond to demographic questionnaires.
Well, only if the health facility that they're in offers that option. In other words, and many of them will. But if they have, the point is, if they have it, if it's available, by all means, fill it out. That's what we're suggesting.
And where does it go? I mean,
Oh, it goes to the, yeah. Hopefully, somebody is doing some research, and they're collecting the demographics. I mean, if you don't know the demographics, you can't know, whether you're practicing the 11th commandment or not. You have to know whom you're seeing, and you have to be able to say, okay, well, we saw these 300 Asian patients and these 300 African American patients, these 300 Caucasian patients, and here's the way we decided. Here's what we decided to do with their knee pain, and then if all three of them show appropriate expected number of people getting the operation they needed, then that's fine. And if they don't, that says, well, why didn't the Asian patients have? And so that's the way the hospital can show that it's practicing good care. And you can't really complain, you can't claim much of anything in that arena if you're not taking the demographics, if you don't know which patients are African American or Asian or whatever. So I think that's what that's reaching for.
All right. So the second one you had wrote was be sure to complete patient satisfaction forms.
Yeah.
So that's when you're in the doctor's office. And
Right. Yeah. And in other words, you're letting them know when they're doing a good job, and you can say, my doctor was very nice. He listened to me, paid attention, seemed to care about me, and gave me good service. Da 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 da. And if you're African American and you're saying that, that's good. That's what they want to see. But if they don't know whether you're African American or what you are, then they can't address the issue.
and then know your patient's rights.
Yeah.
As far as that facility or just
That facility, no, well, wherever you are in America, according to the Constitution, according to one of the amendments says that you have a right to good health care, to equitable health care. And you should know that. I mean, that's true. That's your right as a citizen, as a patient. So that's what we're doing. We're reminding the patients of that.
And then your fourth one for patients
Yeah.
on the checklist is ask questions. A lot of people don't ask questions. Like I put my faith in my doctor. I think that that whatever he or she says is adequate, true, and all that, because whatever the illness is or whatever, I'm expecting that doctor to give me the lowdown. And I don't think I'd ask questions like that because I'm. So what kind of questions should you ask your doctor?
Anything. I mean, I don't mean to be facetious, but the reason I say anything is that it gets the doctor's attention, and it makes the doctor think. Make sure. I mean, not that every doctor won't unless you do this, but there are a lot of doctors that if you don't ask anything, they will just not blow you off, but they may be inattentive to things that concern you. They may not be paying as much attention to you. But if you're asking questions, even if they're not great questions, at least they're paying attention to you. So that's what that does. I mean, number one, it's best to ask good, thoughtful questions. But even if you're frightened, you don't know what to do, you're uncomfortable, just ask, doctor, am I going to have this the rest of my life? Or doctor, can I work with this? Or doctor, do you think I need any more tests? Can't you possibly tell me what's wrong? Are you worried, or should I be worried that you're not quite sure what's wrong with me, etc. Any question almost. And this is just to have some contact, some interaction, which assumes that up till then you haven't had it. But ideally, it'll be a more normal flow, a more normal relationship, so that you would have questions. But it's okay. I mean, there's nothing wrong with that. Some patients really do trust the doctor to the point that they are willing to go that way and say, okay, well, the doctor didn't tell me anything, must not be anything wrong. But that, if you're worried about health disparities, you know, it's much more risky to do that. And so it just triggers the things. It gives you more attention, gives you more acknowledgement, and just makes the doctor think about you a little more, I think.
All right, so we're going to move on to the caregivers
Mm-hmm.
checklist.
Yeah.
And your first point was encourage patients to complete patient satisfaction. So we discussed
Same
that
thing
towards the
again.
end.
Yeah. Yeah.
Humanize your patient.
Mm-hmm.
I hear a lot of stories about how doctors come in, hello, how you doing? What seems to be the problem? And sometimes they don't even look at the patient. Then they'll talk to the patient with all kinds of big words like, we're going to understand that stuff. We didn't go to school for medical things like that. How do you overcome that?
Well, I think that's one of. I'm glad you asked me about that, because that's. I think that's a very important point in the patient-doctor relationship. And if I can just digress a little bit, you can think of a triangle, and two like this. Here's the triangle down here. These are the two corners up here of the triangle. Here's the patient, and here's the doctor. And then down here is the disease. The patient and the doctor cooperate and communicate and collaborate against the disease. So the quality of